questions and answers. Okay, so our recording is in progress. And that you use the Q&A box specifically for questions. And you can ask questions directly to a speaker. You can ask questions in a general sense. But please maintain those questions in the Q&A box. The other thing that you can do today is upvote a question. So if you see that somebody asks a question that you would like to get asked out loud at the end, you have that function of being able to upvote that in the question itself. And we're going to be in the background kind of looking at the questions, making some choices about those. And our chair, Professor Karen West, is going to be asking those out loud at the end. And we're going to invite those of you who have written those questions, if we do choose the question, to come on the screen and ask your question out loud. The other thing to say is that panelists can answer questions. They can type out answers to the questions, so they might be doing that as we go along. And just to note that all audience members are muted. So unless we invite you to speak or you send us a comment that you'd like to speak or ask a question directly to one of us, you will be kind of automatically muted. I think that's it. So I'm going to move on and introduce Karen West, Professor Karen West, who is Professor of Social Policy and Aging at the University of Bristol. She's also the principal investigator of this project and will be chairing the session today.
Great, thanks, Melissa. And great that there are so many participants from such a diverse range of backgrounds here. That's really pleasing. So the aim of this event then is to present the research and policy findings from our project, Can Collaborative Housing Meet the Changing Care Needs of Older People in the UK, the CHIC project. But before we start, you probably will have observed that there's a bit of a change to the lineup here. We've been a bit sort of blighted by sickness today. So Kath Scanlon, unfortunately, is poorly, so can't be chairing this event, although I think she probably is in the audience. And Kath is a member of the team. She's one of the co-investigators. And Julienne Mayer, unfortunately, is also poorly, although she is with us and hopefully will be able to kind of communicate with us in the chat and the Q&A session, but won't actually be presenting because she hasn't got a voice with which to present. So without further ado, I'll just introduce our other panelists, and we've got a great lineup here today. So we've got Jim Hudson, who's one of the co-investigators on the project. He's going to be presenting the main findings, which he'll do for about the first 20 minutes or so. And then I'm going to hand over to the panelists who've looked at some questions that we've posed to them and will respond to the report's findings. Jim will give you a QR code, which will give you access to the project website from which you can download the report as well, because that's gone live today. So our panelists, so Julienne Mayer, as I've said, will be there in the audience, and she's chair of the Older People's Housing Task Force, as I'm sure many of you know, through the Department for Levelling Up Housing and Community. So great to have you with us, Julienne, and hope you can contribute in some way. Brilliant also to have Angie Doran here with us, who is head of the Self-Commissioned Homes Unit for Homes England, so completely up our street, and really, really happy to have you, Angie. That's just brilliant. And Kay Libby, who is Chief Executive of the wonderful Age UK Bristol, and I say that with affection because I used to be a trustee of Age UK Bristol. So Kay, lovely to have you here. And John Stevens, who is on our advisory group, but has had many previous incarnations and professions. John, I think it's fair to say you were an academic at Birmingham University for some time, working on housing issues there. And much earlier on, I think you were head of cooperative housing, weren't you, at Birmingham City Council? So a very rich and varied background there, John. So that's great. So just to present the other co-investigators on the project, Melissa Fernandez-Arigoitia, you've already met, is one of the co-investigators. Professor Misa Isohara is there in the background, as well as Amy Felstead, and they'll be managing the chat and the questions and so on. as well as Jim, who I've already introduced, Jim Hudson, who'll be presenting the main findings. So I just thought it might be helpful to give a bit of background, just very brief background to the project and to explain how it came about. So the aim of the project is really to explore ways in which collaborative housing might help meet the changing care needs of older people. So we're interested in what kind of support people in these communities get from mutual aid that they give to one another, to more formal social care, and how residents think about and plan for their care in these kinds of grouped living, collaborative group living situations. So a bit about the origins of the project. So this is a collaboration between the University of Bristol, the London School of Economics, and the Housing, Learning and Improvement Network. So Jeremy Porteous is also part of the team. And the University of Bristol has had a long-standing interest in the intersections of housing, ageing and care. And many of us in the School for Policy Studies at the University of Bristol have done research on specialist housing, such as extra care and sheltered housing, as well as looking at the delivery of services in mainstream housing. But the research team, the current research team, also has a long-standing interest in community-led housing, and especially co-housing. And we've carried out a number of projects together as a collaborative, including a report on loneliness in co-housing for the Ministry of Housing, Communities and Local Government, as was now DLUC, of course, and collaborative housing during COVID, which was also funded by the NIHR School for Social Care Research, who's generously funded this current project about which we'll be talking today. So I think we've also been inspired by the ideas of social gerontologists on questions of agency and control in later life, and in particular Maria Brenton's work on the importance of agency and self-direction in later life, living arrangements, and for the potential of co-housing. But we also took our inspiration from John Stevens, who's one of our panelists, excuse me, and his earlier work with Jeremy Porteous and the Housing Lin on other examples of later life housing in which residents have taken up the right to manage and exercise control over their own living arrangements in settings such as sheltered housing and housing co-ops. So with the result that we're looking at 6 different kinds of communities, which Jim will go on to explain in a moment, we've talked to some 70 participants across 6 collaborative housing communities, and some of them are here today, and we'd very much like to take this opportunity to thank them all for their participation in the project. Clearly, it would be nothing without them. So I'm going to hand over to Jim now, who's going to give the headline findings, and he'll speak for about 20 minutes or so, and then I'll hand over to our panelists, and we're hoping to have about 30 minutes for Q&A at the end of the session. And as Melissa has explained, some people will be able to present their questions directly to the panelists. So without further ado, Jim, I'm handing over to you now to give the main findings.
Thanks, Karen. Thanks. Yeah, so 20 minutes for 3 years of research work. I'll try and cram this in and keep to the point. So as Karen mentioned, we selected 6 case studies as far as we could to represent the different models that we wanted to look at. Of those, there were 3 co-housing communities, which some of you will be familiar with as a model. They included one so-called senior co-housing community. Not everybody is keen on the term, but we're going to use it for clarity. And also 3 partially autonomous, as we're calling them, communities, of which one was an older people's housing co-op, 2 are self-managed retirement developments, and one of those 2 is kind of comparable to extra care. I pick my words carefully with that because there are differences, but to some extent it has care services built in. It's also important to note that we used kind of a broad definition of social care beyond what you would perhaps normally acknowledge as the spectrum of services and activities by professional carers and agencies. We wanted to try and encompass this broader sense of care in terms of less direct activities that members themselves undertake and are aimed at preventing or delaying the need for formal care services or family support. And broadly, well, there were several questions within our kind of umbrella question, but I guess a couple of them that are worth mentioning at this point in the context of the findings that I'm going to talk about was how does the arrangement of the housing itself relate to the development of mutual support among residents? This is the questions beyond the kind of social ones. And what is the potential for translating these practices and approaches to collaboration and mutual aid into other accommodation settings, such as extra care and supported housing? And I'll come back to that, and hopefully we'll be discussing that in the broader discussion after this. There we go. So, as I say, it's going to be difficult to. This is a very brief summary and overview of the huge amount of data that we've been crunching through that you collect over what, in part, kind of amounted to a longitudinal study over. It was a good 2.5 years that we've spent on and off with these 6 groups. We'll be producing papers forthcoming, but for the time being, I'm going to keep the link at the bottom of each page to the report, which you can go and have a look at and download and read at your leisure. There's an awful lot more detail in there than the points that I'm jumping through here. But to start with, just a very brief overview of the findings. To start at the kind of, you could say, the least surprising end of the findings, the benefits of living in self-managed communities broadly. First of all, for the 3 co-housing groups, we found a high degree of sociability and mutual support, which, although was not unexpected, it does affirm what advocates of co-housing have long said. But previously, there has been a lack of in-depth research around these questions. And as Karen's mentioned, we're able to build on our own knowledge and data from the research we did a couple of years ago for the DLUHC, as they're now called, on loneliness and living in such communities. But we also found with the other 3 groups, the partially autonomous, as we're calling them, we quite quickly discovered that residents weren't usually motivated to move into a scheme because of its self-management model. In fact, some of the people we talked to initially weren't even particularly aware of it. We did, however, find what we believe to be a comparably higher degree of sociability and day-to-day mutual support, at least among an active core of members. And we also found that the act of self-management in each group, the need to run a company, in effect, or a housing co-op, and to run committees and make decisions, that had quite a strong contributory effect to the kind of coherence and the sociability of the groups overall. But it's worth saying as well, it was so obvious for the first few months that we didn't really see the wood for the trees. But one of the most obvious kind of practical benefits of self-management, particularly for the partially autonomous groups, I guess for co-housing, it's being in control, having greater agency, and managing your own housing community is a part of the ethos. It's part of the raison d'etre. So that, in some ways, goes without saying. But for these other groups, what we realized was that it was valuable to all of the members, whether they partook or not, that they had control over their costs of the housing and the services that they used around that housing. The best example that we had perhaps was at Cedar Bank Co-op. I haven't actually been through the names of the 6. I think, did Karen mention that we've anonymized all the groups? I should make that clear as we go into this. But at Cedar Bank, a housing co-op in the north of England, specifically run by and for older people, A few years ago, the adjoining housing, which was owned and run by a housing association, decided to ditch having a site manager on site and withdrew those services, and instead just gave their residents a phone line, in essence. The co-op who had shared the services of a site manager and running a local hub decided to hang on to those services and pay for them themselves just for those members, and managed in the end, as we understand it, to do that more cheaply than sharing with the larger organization next door. And there were numerous other examples which I could talk about for hours. I could talk about all of this for hours, but I'm not going to. Going a bit deeper, moving on from that into mutual support and examples of that across the case studies. What all the groups, all 6, and most of our interviewees had in common was a rejection of what was regarded by many as ideas of institutional care and institutional settings. For the co-housing groups in particular, we saw examples of help in practical ways, supporting members through short-term illness, for instance. And at Hazel Lanes, the senior co-housing group, this was in part formalised during the COVID lockdowns into groups of smaller groups of health buddies, looking out for each other. It's important to say that there were limits both in practice and as recognised by the groups. In the case of the co-housing communities, all 3 were explicit in their community and commitment to each other that these arrangements, the mutual support that they gave each other, were not a substitute for formal care, and especially not for nursing or medical care, which was kind of encapsulated in Hazel Lane's kind of motto almost of we look out for each other, but not after each other. I just want to talk briefly about kind of one of our core findings, really, and the thing that we were expecting to find was less expected. And we've called this management around transitions. And examples of what we're calling advocacy or an intermediary role, where individual members or small groups within particularly the co-housing communities, stepped up to support a particular person who was transitioning to a greater level of care need, sometimes a chronic health condition, sometimes sadly a terminal illness. And in these situations, we saw how a small group of members stepped up to act as an intermediary between health services, social care services, and sometimes family members of that particular person, sometimes going as far in effect as kind of being that adult child who might normally do that. And I know many of the audience today will not underestimate, will either have personal or professional experience of the complexities of shall we say, a crumbling health and a social care service, that that intermediary role of trying to communicate between multiple bodies offering services is a complex and often time-consuming one. So as I say, at co-housing, we found these advocacy roles taken up by small ad hoc groups of members. And actually, I'll jump for a second to the next slide. I'm not going to explain this, but this is just a flavour of the kind of in-depth analysis that we did, that we'll be publishing in more detail in due course. We kind of picked apart these particular situations and looked at the roles of the people within the groups and the people external to the groups, and how those interacted with each other, and what the groups and their members really provided to each other. But we also did the same for the partially autonomous groups, which had comparable examples of people transitioning into greater need, but with the site manager generally acting as the core advocate. and including a particular case at Crescent Crofts, which is the scheme that is closest to extra care of the six, with the site manager there acting as in effect the only point of contact for NHS services when one of the residents came back out of hospital after an operation. I've put planning or not planning for future care need quite pointedly, really. While the schemes such as Crescent Crofts as a form of extra care and essentially with services on site, effectively had you could argue has future-proofed itself in terms of the services required. We found a degree of reticence, meanwhile, at the co-housing schemes and at Greenways, the retirement scheme as well, to some extent. This reticence really to consider collaborating on or jointly commissioning any form of formal care together as a scheme, albeit though we found a lot of informal sharing of knowledge around home help and other services. And on one hand, this reticence was understandable. It's not what co-housing, or particularly senior co-housing, even set out to be, at least not in the UK. But we do think there's an opportunity missed here, perhaps. And we're aware that co-housing and co-op models elsewhere, particularly in Spain, we've come across examples have done this collaboration around commissioning care services. Just as a kind of note, I'm not going to talk a lot about the kind of design aspects of the schemes, but that we found that the reticence to think about planning formally for longer term care kind of spilled over into the approach taken to co-housing design. And we wonder if sometimes, not always, co-housing communities might take aging and support more into account in terms of the scheme design, and in particular the ratio of the size and scale of the homes. Conversely, there was quite a lot that we learned from the approach to co-housing design, both the retirement scheme design might take on board, both in terms of the kind of self-managed schemes that we looked at, which is a very small instance, but also the wider sector. I'm just going to very quickly whip through the recommendations, and I think we'll have more time to talk about this. We have far more, again, as with all of this, in the report in more detail. But we've broken this down into nominally into advice to central government, to local government, to specialist housing providers and registered providers, and to members of groups, particularly co-housing groups themselves. To some extent, it's always going to be a work in progress, and hopefully more will come out of the discussions subsequently on this. So for central government, we do feel very strongly, people will know this who are involved in the collaborative housing movement, that until quite recently there was a community housing fund which provided essential revenue, capital and support infrastructure, which led to the delivery of thousands of homes across the UK, but is no longer in place. Maintain the commitment to leasehold reform is another very important one. We're expecting, I was going to say, a change of government. We're expecting a government perhaps in 2024, fingers crossed. And that leasehold reform legislation is currently at bill stage, and hopefully will move forward through this year. The concept of community priority projects, including community-led housing, we suggest should be introduced into planning law to allow local authorities to require schemes through Section 106 agreements. We'd like to see promotion encouraged of collaborative housing options across organisations that advise on ageing and/or housing, such as the Elderly Accommodation Council, AGE, and others, who we have with us today, obviously. And actually thinking about it, I put that under central government, but perhaps that's a role for us as well as academics to be cascading our findings and our broader knowledge about this sector. In terms of local government, accepting, of course, that local government is under immense financial pressure. So if these recommendations seem glib in that sense, I apologize, but we think it's important to recognize the benefits of choice, control, and the power of self-help implicit in collaborative housing, and ensure that local planning authorities in particular understand the benefits of collaborative housing schemes for older people, to counter fears that we've experienced with planning authorities that they would increase the call on adult social care services. Quite often it's the opposite. In fact, we'd argue in every case. To support collaborative and community-led housing initiatives, i.e. co-housing, housing cooperatives and community land trusts through the release of sites and encouragement as a part of larger development schemes through planning. And I think that that thing with larger development schemes is going to be quite key in the future, that that larger developers might become the impetus to supporting smaller schemes such as co-housing. And finally, or final two, to specialist housing providers to learn from co-housing examples and their designers to encourage greater sociability and mutual support through the design of new schemes. But also to learn from registered providers currently experimenting with the introduction of self-managed housing. And I say registered providers plural. As far as we know, at present, it's Housing 21, the housing association for older people of restricted means, who are driving forward, I think it's 10 schemes around locations in Birmingham, and actually looking to see if co-housing can be enabled. In some senses top down, so there is a tension arguably between that, whether that is truly co-housing, but while we acknowledge that, I think it's some schemes of enormous value that are worth looking at. And finally, to co-housing communities and other collaborative housing projects themselves, just really particularly schemes that don't regard themselves necessarily as senior co-housing, to be open and discuss the group's aims in terms of aging over time. There was a couple of people quite openly said to us that the schemes were not, the co-housing schemes that were not senior co-housing, that they designed for the group as themselves as they were 10 years before they moved in. And of course, the development process is long, and everybody was 10 to 15 years older by the time they were actually moving into their homes. And as part of that, really give thought to physical design and adaptability. And also, as I've already mentioned, to the kind of ratio and size of homes, thinking about issues of succession and how to make those homes saleable again as there's turnover in the group and as the group evolves into a new group of people. So that's it in terms of finding and recommendations. A brief note from our sponsors, as they say. I will jump over from that just to give you back the link to the report, which I hugely recommend. I'll hold on that slide for a few moments, but basically that's it from me. So thank you.
Great, thanks very much, Jim. As you say, condensing 2.5, 3 years work down to a 15, 20-minute presentation is quite a feat, and you did it admirably. Thank you very much. So I'm now going to turn to our panelists who've had advanced sight of the report, so know the main findings, and just to ask them for their reactions from their perspective. So if I can first come to Angie. Angie, so if I could just kind of pose our three sort of core questions to you, beginning with the first one, which is what can be learned from CHIC's collaborative housing models for funding housing and care longer term? So what can we learn from these 6 examples in terms of funding housing and care over the longer term?
Yeah, I mean, I'll start off by giving my kind of main reaction, I guess, to is what a great piece of research, and we really need research like this in order to persuade people this type of housing is incredibly needed. I'll also tell you what the unit does, probably to kind of give a bit of background of what I do. So I head up the self-commissioned homes unit within Homes England, which has existed for just over a year. And the main need for this unit was to try and scale up self-commissioned homes, and that includes self-build, custom build, and also community-led housing. And community-led housing covers all forms of community-led housing, but obviously things like co-housing, they count as being self-built as well as being community-led housing as well. So that's something obviously that I'm particularly interested in. So to scale that up, we need to look at all the things that need to be done in order to highlight why this housing is needed. And I thought what Jim said there about the power of choice control, and that's what I'm all about. That's what self-commissioned homes is all about. We need to give people choice. If people choose what type of housing they have, they stay in it for longer, they're happier, they invest in the local community. I mean, there's so many benefits to self-commissioned homes. So yes, I was really excited to see this piece of research being done. So in terms of what we can do to fund, I took it's been to fund this type of housing to try and make sure that there is funding available. Within the unit, we did a piece of work looking at the Community Housing Fund, which was mentioned earlier on. And that was an incredibly useful fund in the amount of pipeline of this type of housing that was created through it. And that included obviously co-housing projects, community land trusts as well. In fact, Community Land Trust Network have got a really good piece of research on what the Community Housing Fund did and how many they think it helped, it enabled. So we need that back, as Jim said. We need to have a funding. If it's not the Community Housing Fund, we need to have something similar to it. And we have been working really closely, the unit and DLUC, to try and speak to ministers, get it on their agenda and let them know that there is the need. And it's particularly revenue funding that's needed to get these groups going. My background in Scotland I had a background, I saw that David Somerville got a question, I thought, oh, I know David. So hi, David. So I had a background in Scotland of trying to work with groups, and the thing that you said earlier about it taking 10 years, taking 20 years, there's so many hurdles. We have to try and make that easier, and the Community Housing Fund did that. It helped people get to a certain stage by providing the funding, not just for that pre-development work, but also to get professionals to come in and actually work with groups like these enablers, which we really need as well. So I think we need a fund. We need a fund that we don't have to scrabble about trying to find money every 3 years. We need something that keeps itself going. And I know that lots of people within the community housing fund, the community housing sector, have been working again with DLUC to look at potential funding. So we are working on that in collaboration with them just now. And the hope is that there will be something in the future that will help this type of housing to keep going, and that doesn't have to be reapplied for all the time, dependent on governments and changes of housing ministers and everything else. We also need to make it more affordable. So that's where funding's difficult as well, because we have funds within Homes England that could potentially be used to support community-led housing, for example, the affordable homes grants. However, most of the time they need to hit certain categories to apply for it, and co-housing at the moment is quite difficult for people to get funding for it because of the way they select the members, which is required for co-housing. We need to have as was pointed out in your report, you need to have a group of people who've all bought into that same ethos, so they are involved with their community and they do invest in it and help each other. So it isn't just as simple as taking the next 10 people on the housing need register in all cases. So with co-housing, we need to maybe make it more flexible, some of our funding streams, and we are taking a year to the next year for the unit. We're looking really closely at our own funding streams just now and how we can maybe make them more available to self-commissioned homes. So we need to have that kind of funding as well, because I think it was mentioned you weren't looking into the finances of the people, but the understanding was that a lot of people in the co-housing communities weren't necessarily in housing, like official housing need, as in they weren't, they maybe had a little bit more income than other people, although that's a vast generalisation. But we do need to make this available to everyone because of the benefits. So how can we do that? And that's through looking at our own funding streams as well. And we also need to be funding the enablers. So we need to bring back funds that will allow those enablers to come in and work with the groups to make this, to scale this up, to properly scale it up. So I think that was my main kind of thoughts on funding. Hope that answered that, Karen.
Great, thanks, Angie. Thanks so much. So I'm just thinking that I mean, one of the things that we were keen to explore in the project was this, the kind of spectrum, if you like, of self-direction and control. And so you've got co-housing at the one end of the spectrum, where communities get together in order to establish the community from the bottom up. But at the other end of the spectrum, you've got people who just want to kind of have control over basic elements of the management. And I'm wondering, in terms of those self-management elements, you know, what scope is there to scale that up into other housing models from your perspective?
Yeah, I mean, you're quite right. So in co-housing, it's there from the outset, isn't it, that people all have to sign up to it. So maybe it is something where it should be included when people sign up for that type of housing. They should maybe, I don't know if they would give them a questionnaire or something to find out what element of control would you like, or maybe the understanding is that you do have some involvement in your community in order to manage it yourself. Because I think in the findings there were some people who were very involved, weren't there, in the other 3 projects, and then there were some other people that chose not to be. And I know that everyone's different, and maybe not everyone wants to be involved in the management, but that's the thing that gives them that power of choice, isn't it? So I wonder if it is something that these bigger providers or bigger schemes should be looking at when people sign up to it. It should be there certainly as an option for people, I think. Yeah, I think so. I'm just trying to see what my notes were on that one as well. Yeah, almost like it's something that's expected that people joining would actually be involved, I guess, and then they sign up from the outset, and then they're more likely to be invested, aren't they, if it's included? That's just my thought. I mean, I'm not an expert on all of the other models, as I say. It's really the kind of community-led ones that I focused on, but it's maybe an idea.
Great, thank you, thanks. And the final question then, so what are the barriers facing the housing and social care policy environment if we want to promote more collaborative forms of housing and care? So the barriers in current housing and social care policy.
I think the first thing is the recognition of the value of this type of housing, and that's something that someone actually put on the Q&A earlier on, is how do we persuade people that this is something that's valuable and needs to be supported? And I think that's where us working for the government need to be engaging with the MPs, bringing them out to see places with the, with Housing Minister, with other people within our bigger organisations, to get that buy-in from higher up in the organisations as well. We need to take them out to visit these projects, to see them in action, because that's incredibly powerful, and then to get their backing of that's the recognition of it, and then that's where people will start actually to bring in the policy that will support it. I also think, as mentioned before, we need the funding, and that's a big barrier. So that the barriers really to safe housing are similar to the barriers to any form of self-commissioned homes. People don't see it as being useful, they see it as being niche. They don't realise that in countries like Germany, it's the standard thing that's done. So we need to have funding to support these particular types of projects. We need to have expertise there to deliver these types of projects, because if we do manage to scale them up by making more land available, which I'll come to in a second, then we do need to have the people, the enablers, to help to deliver these projects. And that's from just standard self-build, but also from these type of ones, we need the enablers to help the groups. And yes, availability of land. So a lot of the time, obviously, groups have to compete with big developers in order to get a piece of land. And that's certainly not going to make it affordable for that group. So we need to have land available for them at less than best consideration. We've recently brought in a less than best consideration policy within Homes England. So the hope is that we can actually use that policy to support community-led organisations as well. That's something that I'm working to try and persuade people of within that. There's a bit of work to be done with it after this, but yes, we need that availability of land, and that means that we have to look at our planning as well, that local authorities actually also recognise this as being a really important form of housing, and that they have like exception sites that are set aside for community-led housing. There's less objections from a local community if it's actually community-led housing that's happening on the edge of a rural settlement. But we also need it in our towns and cities as well, not just in rural areas. We need it where people are. So I think we need to look at our policies. We need to look at, there was a mention of a 106. We could be, a lot of local authorities now have percentage policies on larger sites where the developers of those sites have to set aside a certain percentage for self and custom build. Co-housing is a form of self and custom build, so a lot of local authorities maybe don't realise that they could be supporting co-housing projects to deliver part of their obligations under the Right to Build Act, where they do have to make land available to meet demand. Obviously, not all community-led housing will count as self and custom build, but maybe there could be policies brought in for community-led as well within local authorities. So it would be good to to create that land availability within potentially Homes England sites, but also within local authority sites as well. And I think that would make a big difference to it.
Thanks, Angie. So there are quite a few questions popping up, but I think I'm going to save those up until I've heard from all of the panelists. But I think some of those questions will come back to you, Angie. So thank you very much. So if I can come to Kay now, Kay Libby from Age UK Bristol, who I think is probably going to approach this more from the sort of social care angle than the sort of housing angle. So over to you, Kay. So I think you've got some things that you want to say that in which these questions are sort of embedded, right? So you don't want me to pose them to you individually.
That's right, and hopefully I'll just sort of take a bit of an overview and answer some of those questions as I go through. So good morning, everyone. I wanted to start by really welcoming the report's focus on preventing social isolation in looking for housing solutions for people as they age. That really resonated with me. We've done quite a bit of work in Bristol on tackling social isolation over the last 7 years. Michael Marmot said way back in 2010 in Fair Society, Healthy Lives, that people who are socially isolated are between 2 and 5 times more likely than those who have got strong social ties to die prematurely. So I think, it is worth reminding ourselves just how important our living conditions are and how important an age-friendly community is to us in terms of health and well-being. It's important that we bear the impact of social isolation in particular in mind as we adapt to demographic changes in society. Just spending a little bit of time looking at the impacts of social isolation, if I may, it can have physically and emotionally damaging effects, resulting in depression, poor nutrition, decreased immunity, anxiety, fatigue, and social stigma. So reducing isolation can have tangible health benefits, with research highlighting that weak social connections carry a health risk that's more harmful to us than not exercising. It's twice as harmful as obesity and is comparable to smoking 15 cigarettes a day or being an alcoholic. So it's really quite stark, the difference that can be made through improving people's social connection. There are studies that indicate that socially isolated older adults end up with longer stays in hospital, greater numbers of visits to GPs, and are more dependent on home care services and support. So it seems to me there's therefore an economic as well as a health-related case to be made for tackling social isolation, however we do that. And I think that it's really good to see in this report that collaborative housing could be that menu of options, if you like. Early intervention to tackle the issue is likely to have longer term cost benefits if it helps to improve people's health and well-being. But also picking up on what Jim and Angie have just said, actually, I think the earlier intervention is really key. We tend to leave things too late before we choose to change our housing arrangements. Maybe we've been in our family home for a long time, tend to leave those decisions to move until it's probably too late for this sort of collaborative housing as an option. So really important that we get information out to people about and promote these sorts of options if they're available in their areas. At a community level, social isolation is less likely, will be less likely if there's mutual assistance as a principle in a community and if reciprocity is the norm. So it's really good to see where those principles are very much present in collaborative housing and in some of those 6 cases that Jim has showed us. Personal social skills are also that will also influence our experience of isolation, and that could be those social skills could be more developed for some people than others. They're determined partially by our cultural background, social and economic status, and our gender. And the report picks up on the fact that the housing studied in the reports wasn't diverse. And I think I'd like to note here the need for more work to be done to look at how the benefits of collaborative housing can be extended into different communities, individuals and groups. So I do think a range of new and innovative housing options are clearly needed as we adapt to the fact age. That's a cause for celebration, but it does mean that we need to change and adapt as a society. More people are living alone through choice or otherwise, and there's still greater mobility, with families, relatives much more likely to live apart from each other. And there are fewer people in caring roles or volunteering roles as well at the moment. Women have traditionally played a larger part in caring for family members, but the rising retirement age for women and the cost of living crisis generally means that both men and women need to work for longer. So caring for aging relatives isn't so easy for us to do. While not everyone will need intensive health and social care support in older age, I think it's important to emphasise that it's ever more important that we focus on maintaining and improving people's well-being as they age. I felt it was really heartening to see in the report that there's evidence that collaborative housing potentially offers that support network of others living with you. So at its best, those you live with will be friends who enrich your life, make you happy to be around them, and with whom you can have that mutual supportive relationship. There's more chance in collaborative housing, it would seem, that you'll have the opportunity to support others and to feel useful. And I think that we do know from research that feeling happy, and I've used these words on purpose, feeling happy and feeling useful add years to your life. So those are really beneficial to our health. There's lots more potential for communal events and for people living in collaborative housing to be and feel a valuable part of their local community. The report has emphasised that collaborative housing could be beneficial for people of all ages. So I'm here speaking for older people, obviously, but staying with social isolation as a theme, we know that that's a benefit for a wide range of people, no matter your age. We know social isolation can also be an issue for a range of other demographic groups. I'm thinking for women experiencing domestic violence, carers, both young and old, young or lone parents, and for people from all equalities protected characteristics groups. So I do think that there's options, there are opportunities there for looking at this as a model for all ages. It's good to see recognition in the project that collaborative housing can particularly help if there are times that someone needs more support, because there are others around who may recognise their increasing needs in the first place. So it's more likely having that network around you will mean your needs are picked up sooner, acted upon, and maybe there's some support in the house while you need it. So this could prevent somebody's needs from escalating to the point that they need more formal help from statutory services. And having several people in the house could also mean that there's less pressure on one familial carer to support someone. It means that the living situation could be maintained for longer. And I also took from the project that there's a need to ensure that local statutory services, health and social care, recognise the preventative benefits of collaborative housing, but that they ensure that the mutual support that schemes like this can potentially offer isn't compromised in future. People feel that maybe supporting others has become a problem for them or has become a burden. So I think it would be good to see support for these schemes in the way that the report identifies, linking them up with local social care providers, for instance. And in that respect, I suppose I would say this, but I really do think that local voluntary, community and social enterprise organisations would be particularly useful, because they're likely to provide a more holistic approach, looking at a wider range of aspects of the person's life, rather than just their health or social care or their direct support needs. The report also refers to the potential support of this type of housing for people who might be leaving hospital, and I just wanted to touch on that. I think for a temporary period, this could really be a good option, and I wanted to endorse it with our own experience in Bristol. So we're a voluntary sector provider of support to local hospitals in the city. And we found out that as we age, if we need to go into hospital, it can be harder to be safely discharged home in a timely way, and various things can delay discharge from hospital. We've typically found that those key things people need support with are around finances, housing, caring responsibilities, managing new or multiple medications, and also the need to set up adequate support in the home on a short or longer term basis. So having that supportive network of people together, there's no doubt in my mind it could potentially reduce the need for more formal support in the short term, and it could speed up the person's ability to return home. We do find if older people have fallen, for instance, their confidence is knocked. So having others around will just kind of help with that, the confidence that they need to literally get back on their feet. But I really need to stress that isn't a replacement for personal care, and it's not a replacement for support in the longer term. It could also support somebody, though, who's providing the main caring responsibilities. And I think we can't underestimate the impact on familial carers of that support, as mentioned by Jim earlier. In addition to the costs of all of those kind of delays to coming out of hospital and the cost to the state, it's also just not the right place for someone to be when they're ready to go home. And we know that it's easier for people to become deconditioned or out of condition while they're in hospital waiting for discharge. So we really don't want people coming out of hospital in a more deconditioned state than they went in, if you like. And it's really important that people get home as soon as possible. That support at home, enabling enough support for somebody alongside maybe formal home support, could prevent also the need for a temporary move into a care home. So we have seen examples where because there isn't that little bit of support, somebody living on their own has ended up going into a care home on a temporary basis initially, just for a period of what used to be called convalescence before they return home. And unfortunately, care homes may not be the best option for people, and a temporary move into a care home can end up being a permanent move. So I think it's really important we get people back where they belong, back home as soon as possible. And I think that different forms of housing have the potential to be part of a range of ways that we can prevent the need for more intensive forms of support. So in summary, I'm going to finish my views on the project. I think it's highlighted several preventative benefits of this type of housing and the need for promotion of this as an option for more people. We tend to resist making that change in our housing arrangements as we age and leave things to the last minute, which can be too late for these sorts of options. So we really need to be looking at promoting them where they're available much earlier. The potential for savings in health and social care costs warrants encouragement from both government and local authorities around the development of more self-managed housing options, and to look at the current sorts of options of housing options locally, and to see whether or not some of those could become more self-managed. I was interested in Jim saying about the need for a paid site manager within schemes being picked up by the older residents themselves when wardens were withdrawn. And I think that's a key one for me. We hear quite often that older people very much miss housing wardens when they're removed for cost-cutting reasons. It's really interesting to see that older people would prefer to pay for that support. And I think that will probably be a key feature, particularly if we want people to age in place. So how do we do this? I'm going to end with one step. With the establishment of integrated care systems, I would hope that there is room now for timely discussions on how the development of more collaborative housing options can support people in communities as they grow older. And we should really be talking within our integrated care systems about how they can support this. Thank you.
Excellent. Thanks very much, Kay. So some of the points that you've touched on are things that are coming up in the chat that I'll come back to. Particularly, I think this question about interaction with care providers and the regulation of care in these kinds of settings. But I'll hold those for now and come back to them. But some very useful insights from you there, Kay, which will help in the development of further recommendations. John, can I come to you now?
You can, Karen.
So you don't want me to pose the questions to you. You've sort of embedded those in your response, I think.
Yes, I hope so. Yes, I hope so. Right. Well, hello to everybody. I'm speaking today as a member of the CHIC advisory group, but I would stress that the views I am expressing are my own. The advisory group has been very involved in this project, but we haven't actually met to discuss the recommendations of the report as such. I've been involved in promoting forms of housing controlled by their residents in one way or another for many years. I did work for Birmingham City Council, Karen, but not in that capacity. But at one point I was employed by the Housing Corporation in promoting resident controlled housing. Then between 1993 and 2009, I was the director of a specialist housing agency that developed and supported fully mutual housing co-ops, that is co-ops for social renting, like the Cedar Banks co-op in the scheme, in one of the pilot studies. And we also supported tenant management co-ops that took over the management of council-owned housing. In this period, I observed that cooperative housing seemed to work particularly well for older people. There were two main reasons for this. Firstly, older people played a significant, one might say a disproportionate role in running the co-ops. They're drawing on their life skills and experience, and this in turn helped them to remain active and engaged as they grew older. The second benefit, though, was that as and when they needed more care and support, they benefited greatly from belonging to supportive and cohesive communities that tended to be engendered by co-ops. So in 2010, when I moved into housing consultancy, I decided to investigate whether these benefits applied across different forms of resident controlled housing for older people. Over the next 6 years, with sponsorship and support from several organisations, including CDS Co-ops, Housing 21 and Housing Lynn, I undertook various pieces of research, and I uncovered a variety of examples of collaborative housing that went beyond the co-ops and co-housing schemes with which I was familiar. With Housing Lynn, I published several reports, including Growing Older Together, the case for housing that is shaped and controlled by older people in 2013, and Growing Older Together, an overview of collaborative forms of housing for older people in 2016. These reports contain 20 case examples of resident-controlled or collaborative housing, as I decided to call it, for older people, ranging through community-based housing projects for older people, community land trusts, for example, housing co-ops that focused on older people, not just specialist ones like Cedar Banks, but other co-ops, resident management retirement housing schemes, which was a form of housing which I was unaware of, in which residents took over their retirement housing schemes using right to manage, of which I think there are a large number that are not, perhaps 50, 60 or so in the country, and various other schemes. Sorry, I've lost my plot here. Some of these schemes have been established for 20 years or more, while others, such as the co-housing projects, were just getting off the ground. Although the schemes differed in terms of how they were established and the form and nature of resident control they offered, I identified certain qualities that all the schemes shared to a greater or lesser extent. Firstly, the older people living in all forms of collaborative housing stressed the overriding importance of being in control and of feeling secure in their homes. Secondly, people told me that it was important that they collectively decided how their housing was to be managed and maintained. And in those schemes where the residents employed staff and used outside agents, it was important that the staff and agents were solely accountable to them. Almost all the older people I met told me that they enjoyed being part of lively and self-directed communities. They also told me that this enhanced their general sense of well-being and reduced the threat of isolation and loneliness that often accompanies old age and which Kay referred to. I observed that this good neighbourliness, which was a feature of almost all the schemes I visited, often extended into more significant levels of what I term mutual care and support, in which certain residents or groups of residents would offer informal personal care to each other, and I use that term advisedly. I also noted that in some schemes, these forms of support was facilitated and supplemented by on-site staff taking advantage of the flexibility they had as a result of being employed directly by the residents. And this was in marked contrast to site managers that operate within schemes run by housing providers. And I speculated that while this mutual care and support might not be a substitute for more formal care, it might delay or even offset the need for it. However, I recognised that this was an aspect of collaborative housing for older people that required further research. And in the next few years, I was involved in discussions with Jeremy Porteous at Housing Lynn and with many of the people associated with this project about how such research might be undertaken. I was therefore delighted when funding was obtained for CHIC, and also I was delighted to be invited to join the advisory group. The 6 case studies undertaken by CHIC include 2 co-housing schemes that I had referenced, but which had not been completed when I did my research, whereas the 3 other case studies all featured in my earlier research. At this point, I would like to emphasize that these other schemes all differ from each other, and I think the point is made within the report. So it does make comparisons a little bit more tricky when you look at the other schemes in the study. I also, and this is a slight quibble, I'm not quite sure I like the term partially autonomous in relation to these schemes. Cedar Bank's co-op, for example, is really fully autonomous. I mean, they choose to outsource some of their services to an agency, but they are as autonomous really as a co-housing scheme in that they collectively own their housing. But nonetheless, I understand what the group are getting at when they look at these degrees of resident control. Unsurprisingly, I'm pleased by the findings of the report because they validate some of the things that I've been saying for some years. They pick up the overall benefits of self-management and the value of living in self-directed communities. And they also identify some significant long-term challenges which need to be thought about as well. I would particularly argue that attention needs to be paid to the role of support networks for collaborative housing. And I would highlight the agency that has worked with Cedar Bank Older Persons Co-op for 40 years and enabled them to survive and prosper, and which played a very significant role in helping them to hold on to their site manager. This very important example, I think, which was given, which shows how the power of collaborative housing when faced with some kind of external threat, as it were. The close examination in the report of how mutual care and support manifests itself in the case study projects draws attention to the value of these one-off arrangements for informal care that are found in several of the case studies, but it also talks about the limitations of those arrangements. Jim referred to the complexities of the management of the transition between informal and formal care, and the fact that this tends to be seen as being outside of the remit, the formal remit of the schemes he was looking at. But I do think it's significant, and this is picked up, that collaborative housing seems to have several what you might call enabling features that can support individuals when they come to examine future housing options at a time when perhaps they become more frail or when they do need formal intervention. When considering the case for expanding the supply of collaborative housing for older people, it might be argued that the sector is currently very small, even marginal, consisting of perhaps no more than 100 schemes with collaborative features around the country. However, when I wrote my report in 2016, I argued there were several reasons why collaborative approaches to the provision of housing, health and social care, and I pick up on what Kay was saying at this point, should be given much greater priority. And I believe these arguments have gained even greater cogency in the intervening years. Firstly, demographic changes are leading to an inevitable reduction in the size and scale of family-based care and support networks for older people that currently enable so many older people to continue living on their own. And Kay mentioned this. These demographic changes, I think they call it the demographic deficit or something like that, also mean that the resources available to cover the cost of publicly funded services for older people are under growing pressure, and that this will inevitably lead to continuing restrictions on formal services. So there are these two problems, as it were, which Kay alluded to. A more positive development, in my view, is that the changing aspirations of older people require much more flexible and people-centered forms of provision that connect health, housing and social care, forms of provision that are developed collaboratively and driven by older people themselves. All of this means, in my view, the recommendations in the CHIC report aimed at scaling up the collaborative housing sector for older people are of considerable importance. Angie gave us a very good idea of the kind of thinking that has been developing in the community-led housing sector. And it's quite clear that strategists and policymakers need to provide sustained support and investment in collaborative approaches to housing of all kinds, but particularly older people's housing. And the aim must be to ensure that collaborative models of housing for older people are an option that is available to all older people. And reference was made to the fact that at the moment, these options are not available to quite wide swathes of the population. To achieve this, housing providers of all kinds need to step up, whether they're private developers or social housing providers. They need to overcome their institutional resistance to community-led forms of housing and to develop a range of innovative and collaborative housing with care solutions for older people, following the examples of a few pioneers such as Housing 21. I would draw attention in particular to the phenomenon of right to management in retirement leasehold schemes. I estimate that around 50 to 60 schemes have been taken over by the residents, possibly more. And this shows there is a genuine appetite amongst people in older people's housing provided by another provider to actually run it themselves. And yet, as far as I know, no developers at all have actually brought a product to the market, as it were, which offers people management from day one. Why not? I think it's because they've got too much money tied up in their existing models, and this model perhaps doesn't enable them to extract as much money as they can do from these models. But there clearly is an appetite for these approaches. I should end now, but clearly the sector itself needs to actively promote the benefits of collaborative housing, and events like this are a great opportunity for people to learn more about collaborative housing for older people. Thanks.
Brilliant, thank you, John. So as you've all been talking, I can see I've got millions of things popping up in the Q&A and the chat, which my colleagues have been trying to sort of package up for me. So let me just go to some of these. So I think I want to come actually to a question that's been raised by Maria Brenton, which concerns the regulation. So the social care, so I think that what Maria is referring to is a sort of CQC regulation that would apply to collaborative housing communities that employ carers or that organise care. And I think that's a very significant issue. And again, I mean, if we have made other recommendations that Jim didn't mention, but I think there is very much a need to kind of look at the regulatory environment around care, because the last thing one would want would be for these communities to be falling foul of care regulation. So just to pick up on that one. Other questions? Let me see. Let me just go through here. Okay, so from Deborah GW, how do we help politicians and housing officers see this as a solution and facilitate implementation? housing is still seen in terms of numbers of units, and the rhetoric of supporting community-led housing, appreciating the triple bottom line, benefits, etc., doesn't match the reality on the ground. For example, inclusion in local plans. And for those like Deborah GW, who've been campaigning for years trying to promote what seem fairly obvious solutions, it's exhausting, demoralizing, and expensive. Do we have any suggestions from the panel? Now, I don't know who wants to pick up that $1 million question, but it is true, isn't it, that it's demoralizing and exhausting, and there's lots of rhetoric, and the benefits are clear for all to see. But how do we shift the dial in terms of policy making? So Angie, maybe I'll come back to you on that one, because you did touch on that in terms of things like making more land available and so on, and promoting enablers. But perhaps you could respond to Deborah's question, because I can feel the frustration coming through in that question, and it's echoed by other people as well in the chat.
I think the number one thing is to try and, I think someone also mentioned it in the chat, is to try and change people's attitudes towards this type of housing through education. They're actually showing them the schemes. And I think that can be, as I mentioned before, incredibly powerful. We need to get the politicians and the local authority members out to actually look at these schemes. When they see them, they're kind of like, there's enthusiasm, there's people saying, yes, we need more of this, but then to actually make them move towards it, we need to bring in proper policy, and that's what we're trying to do, obviously, within Homes England and with the department as well. So I think we need to, it's not an overnight fix, but it's about that education and recognition of them being valid forms of housing, rather than just kind of a few random people wanting to build their houses together in a commune, which is the kind of attitude people have. It's the same attitude people have to self-build. They think it's only for a group of wealthy people, you know. And it doesn't help that we have programs like Grand Designs, which is very entertaining, but it's not realistic. Like, most people don't have a £2 million budget and go over it. You know, we need to actually make it clear that there are affordable options, that it can benefit communities in so many different ways, and that's through showing the politicians, and also from within, people working within organisations like Homes England, for myself, and obviously people working within the department, within DLUC. We need to be continually making it on the agenda for our colleagues, so that they know also that this type of housing needs to be supported. And obviously the other things like making land available through policy and through bringing funding back as well, as mentioned. So yeah.
Great, thanks Angie again. So I've got another question here from Yanting to the project team. Oh, John, sorry, you want to come in there on that?
Sorry,
question?
I thought that Marie's question about the CQC merits some discussion. Clearly is a very tricky area in terms of the sort of crossover from what is good neighbourliness, practical help, but then if it goes into sort of medical or areas of health, then this question of CQC registration comes into it. I noted from your report that you'd referred to the fact that the co-op, Cedar Banks Co-op, through their agency, had got, is it limited CQC registration? And that again seemed to me rather interesting, that a co-op had managed to go into this territory. But I don't know whether you could pick up, is this something you picked up, Jim?
Well, it's I'll comment on it briefly, because it's not my specialism, but as I understand it, because there's different levels or different kinds of CQC registration for doing different activities, but we thought it was interesting, and I think this partly responds to Yanting's and to Maria's questions, that this external organisation could handle the bureaucracy and the expense of being CQC registered that the co-op was drawing on. And as I understand it, it's an umbrella co-op, i.e. a secondary co-op, as you said, John, that provides services to a whole number of co-ops. And we did wonder if, in response to Maria's question, talking about a co-housing group trying to take on board CQC registration, avoiding that by going to another, either a co-op or registered organisation that could do that for them. I think especially the problem with co-housing at the moment is it's so scattered and so limited in numbers that you'd need to find an organisation that would be countrywide. I think that's one challenge. But I thought it was really interesting that Yan Ting, as says in her question, she's from an independent home care service. I don't know if she's able to. Oh, she says I don't have a camera on the computer, but I don't know if she's able to say something about that. Would be interesting.
Can we hear from Yan Ting? Is that possible, Melissa?
Yeah, hello, can you hear me?
Great.
Yeah, sorry, I just don't have the camera.
No, brilliant.
Yeah,
Thank
but
you.
yeah. So we are a home care company based in Northwest England, and we provide just independent registered CQC home care services for mostly it's like council funded clients, making sure that they're living independently at home and providing personal care services and these companionship services. It's just because we want to reach out and see, how to collaborate with the housing groups and see if there's any chances there, so we can send carers to meet, even just companionship, reduce social isolation, some measures that we can do to help. But we really receive very few feedbacks like they show any interest. I just wonder, is that like part of in their scheme that they don't really want to incorporate care from their side? They don't really want to sort of liaise with the care services, or they just I'm just not too sure. Yeah, hope that helps it with a little bit background here.
Thanks, Yan Ting. That's really interesting. So you've tried to be in touch with what co-housing communities, is that right?
Yeah, like just like we touched on before, it's not the extra care facilities. It is the older people housing, just the older people, for example, like retirement apartments, places like that. They only provide housing without care.
Okay.
Yeah.
Okay. So well, shall I take that, Jim?
Yeah, do you want to?
Thinking about co-housing. I mean, so I guess what I would say about co-housing is that, well, the one scheme that we've looked at, as to our knowledge, is the only manifestly older persons co-housing scheme. So many of the others are, in fact, intergenerational, and I suspect that they're not probably at the stage yet where they're thinking in these terms, and are very much focused on what community members can do for one another. But it's interesting, actually, in conversations with the co-housing communities, that they are sensing, a need to start kind of reaching out externally, but I'm not quite sure how to go about it. And I think, social care is not so much on the radar. I think they're very much in tune with healthcare services and understand how to access healthcare, but are a bit less sure about how to access social care. So I would say, I mean, they're not very numerous, are they, co-housing communities? But as they come on stream, I would say, just keep interacting. I think there's something that we've sort of picked up on in the report about, and Jim sort of touched on it in the findings, which is about some of these communities sort of seeing themselves not as, communities for older people. So they were, established when they were at an early, perhaps just at the point of retirement, and are very much thinking about that kind of period of life rather than much later on. But again, that will change as these communities come of age. They are going to find themselves in need of some kind of external support. And it sort of takes me back to Kay's point here, really, that, there is no kind of supplanting more formal social care support. There are limits to what community members can do for one another. But I think the thing that you picked up on there, Kay, which was quite a strong finding in our research, was that members of community can support the carers. So we've got another example that we've discussed at length in another paper, in which the son of a man who sadly had a terminal illness lived abroad, came back, was obviously, incredibly anxious about coming back to look after his father, but the community members were able to rally around and care for him as much as they were caring for the resident themselves. So that is definitely something that is happening in these communities. Jim, I don't know if you or any other members of the team wanted to come back to any of those points, but thank you, Yanting, for your question. Jim?
Yeah, it was just to add a thought in terms of, as well as the three co-housing groups, there was Greenways, which I didn't really explain at the beginning. So that they're leaseholders in a retirement complex who've taken over the right to manage through existing legislation. So they don't own the freehold of the block, but they do manage the whole scheme. And it was interesting that we found a bit of resistance is probably the wrong word, but when we put this idea to them of a sort of external organization that they could employ formally, they were a bit bemused, and this phrase that came up regularly, this independent living, is what they describe themselves at. And this was kind of an article of faith, that they were saying, why would we do that? Because we're not a care home, which is another phrase that came up quite a lot. So there's a kind of mental leap there to be made, even for something that might be useful, I think. But there were definitely, it was only really the co-op Cedar Bank and the extra care scheme Crescent Crofts that kind of had considered doing that formally. The others rejected the notion to some degree. So anyway, thanks.
Yeah. And Sheila Peace here. Hello, Sheila. Good to see you. Well, I can't see you here, but good to know that you're here. She says, I think you'll find that those agencies providing home care, what was once called domiciliary care, can be regulated agencies providing support to individuals living in co-housing rather than that the collective dwelling be regulated. I think that's absolutely right. And I think that speaks to Yanting's question as well about being an independent care provider offering services to these kinds of communities. Okay, Julianne has put something up here. Julianne Mayer has put something here in the chat.
It's just, I can see Kay's hand has been up, so I'm just calling her in for this question.
Okay, right.
Thanks,
okay. Sorry, Kay's gone off my screen here. Sorry.
Fine. Thanks, Karen and Melissa. Yeah, I just wanted to come in on the point that Yanting had raised, and I think we've kind of talked quite a lot about regulated CQC regulated registered care provision, and I just wanted to make sure that we didn't kind of just go down that rabbit hole. You know, what we've been talking about all the way through here is earlier upstream prevention, and I think, you know, if self-managed communities want to make, I think it would be a good idea for them to make contact with local community organisations, voluntary organisations, just as a matter of practice, because there is a level of support there that could be tapped into, even if it's just information signposting about what's available. But actually, sometimes the things that make a difference to people are not necessarily personal care, it's other stuff. And the voluntary community social enterprise sector has got a wealth of experience in that respect, and they will look at the wider determinants of how they'll know about transport, culture, leisure, other stuff, not just care. And I think there's, you know, sometimes I think we can over-egg the need for home care. Maybe people might need some home support without the personal care side of it. So it's not to say that the care element isn't needed, but I think we need not to just kind of focus so much on personal care. I think there's a need for other support as well before you get to that stage. Thanks.
Yeah, very good point. Thanks, Kay. I'm just coming to Anne Gray here, who's asked a number of questions, actually. Anne, I wonder if you wanted to pose your question directly. Particularly the very interesting question about co-production models being established within sheltered housing models. Anne, are you there? Are you happy to ask?
Yes,
your question?
I'm happy. I can't find my camera. Is that okay?
No, that's fine.
Yeah.
Hello, Anne. Yeah.
Yeah. I mean, basically, you know, I did research on sheltered housing schemes for quite some time, and if people want to look up the publications, they can. But I'm also very aware of problems faced by residents in a local older people's group that I'm involved in London as secretary. And, you know, the problem is people have owner-occupied properties. They have very few sort of project management skills about the transition to any other form of accommodation. Many of them are, what shall I say, non-graduates, often from ethnic minority backgrounds, don't know the kind of people that could help with that kind of transition unless they pay through the nose for a fee for someone to do it. And, you know, confronted with the huge management responsibility of, first of all, managing collaborative housing, if you can get any, and secondly, doing all the planning process for co-housing, which, as we all know, may go on for years, given all the obstacles. You know, I think what they want is a quick fix solution into something which is accessible to owner-occupiers, which helps you manage the transition from selling your own home and going into somewhere else, and gives you lots of advice about that and helps with the actual sale and so on, you know, down to decluttering and all that. And would then, you know, provide a process whereby co-production could put professionals at their disposal as a group to develop something in which they have a big say over how the place is run, but they don't have to engage in minute-taking, contacting professionals, commissioning, all that kind of thing. So, I mean, I wonder if anyone has explored this issue in other cities, perhaps, or even in London, and would like to engage about it. Thank you.
Thanks, Anne. That's really interesting. I wonder, is there anybody in from Housing 21? Is Vanessa there, or Bruce, or anybody out there? I don't know whether they are or not. But the Housing 21 project sounds quite close to what you're describing there, Anne, in the sense that the Housing 21 is taking on the responsibility of actually developing the scheme, but is in a sense kind of curating a community of people who want to live together in this way, which sounds somewhat akin to what you're describing. I also think it comes back to John's point about there being no product on the market currently, John, as you said, that enables people to self-manage from day one. And I think, again, that speaks a bit to what Anne was referring to there. So that's a plea to specialist housing providers to make that offer.
Shall I come in a little bit on that, Karen? Unless somebody
Sure.
from Housing, it's somebody from Housing 21 out there, because I'd have thought there must be.
Hello, can you
Yes.
hear me?
Ah,
This is Sheila Peace.
Sheila. Hi, Sheila.
I've just had a message from somebody called Steph Ramsden from Housing 21,
Right.
who's obviously on this call.
Yeah.
Hi, I'm Lucy Hales from Housing 21.
Hi.
I just put a message in the chat.
Yeah.
Hi, that's okay. So just to know I'm here. Yeah. So.
Okay. So.
Shall I carry on then?
Sure.
Perhaps Lucy will chip in. I think developers and social housing providers could and should do much more. In terms of private developers, I got I raised some really fundamental questions as to why the mutualization of retirement housing has really gained traction through Right to Manage, and yet no providers, as far as I know, have thought, oh, wait a moment, there is actually a demand for housing which is managed by the residents themselves, possibly with the right kind of supporting agency behind them, which was alluded to. So that's a question which hangs out there. Possibly leasehold reform, and I'm not quite sure whether this covers it, but the introduction of what's called common hold would be a really good idea in terms of older people's housing. Turning to social housing providers, again, I think their performance in this respect is very disappointing. There was a reference to sheltered housing and all the debate about the future of sheltered housing, etc., etc. As far as I know, no social housing providers have looked at what might be called the mutualization of sheltered housing, which would surely be a very interesting model to explore, looking at the lessons of Cedar Banks, for example. And also, one of the factors is social housing providers have an aging population in terms of their tenant profile. And in fact, in some areas, social housing providers, perhaps 75% or 85% of their tenants will be older people. So why aren't they looking at developing collaborative networks within their general needs housing, where there's a very high proportion of older people? And this in turn could connect with the wider community in the way that Kay suggests. You know, clearly social housing providers could do a lot more at the neighborhood level in terms of interconnecting their own older people and supporting networks, and also connecting with other networks in the local community. So I do think that social housing providers need to step up.
Yeah.
Don't know whether there are any
Thanks,
social housing providers there who want to respond.
Great, thank you. Sorry.
Do you want me to say something about
Yeah,
Housing
Lucy, that
21?
would be helpful at this point, I think. Yeah.
Older Persons Project, yeah. Housing 21 is a specialist older persons housing association, so we don't have any general needs stock to transition people from, but as an organisation we've got about 22,000 properties nationally across the whole of England, and we're about to start to build our first co-housing scheme in the Lascelles area of Birmingham. So that will start hopefully in February, but we've been working on that project for probably the best part of 4 years to identify people that would like to live in that type of environment. And there is a lot of interest, but one of the challenges that we've got is people need housing, and they need housing quite quickly. So it's a very long journey to take people on, and we've prioritised working with Black, Asian and minority ethnic communities as well, and I think Kay talked a little bit about the Marmot report and the disadvantages that those communities experience in relation to health. So that it has been a very long journey before we sort of get to a collaborative offer. It's probably, the scheme is likely to be completed sort of round about the autumn of 2025. So it's a very long time for people in housing need to be engaged, but there is an appetite for people to create co-housing communities within a social housing scheme.
Thanks very much, Lucy. That's really helpful insight into what Housing 21 is doing in this space. And it actually is quite a nice segue into some of the messages that we've had in the chat and the Q&A about the lack of diversity in current communities. And that is something that Housing 21 is very much responding to. And I know that Sheila Peace and Abdul Ravat have both made comments about diversity. I don't know if either of you would like to come in and say something at this point. Sheila, are you there again?
Yes, can you hear me?
Yes.
Okay, you can. Well, I raised a question because I'm working on a team from the OU, but also with the Bangla Housing Association and the Housing Lin, with the Bangladeshi community in Tower Hamlets, Newham, Hackney and Redbridge. And we're obviously interviewing people in the main in their own housing, but often it's very intergenerational housing. The local authority has been able to create 4, 5, 6 bedroom joint apartments, various other innovative schemes. The whole idea of co-housing and collaborative housing is not something that anybody talks about, and yet the community is very supportive of people, as well as the familial support. And I suppose as I'm listening to you, and what I know about this area of work, I'm often thinking, would people be interested in this type of housing? And I knew Housing 21 were working on a development in Birmingham. People don't have information. They don't know about this way of living, and yet their community is very supportive of helping each other who are not necessarily part of the family, as are generations. And so I suppose I was just considering ways forward. We have been able to, through a really detailed co-production approach, set up a Bangla research advisory group. We're trying to do something similar with the professionals and practitioners in these London boroughs. None of these things happen overnight, but ideas do, and filter through bringing the groups together. And the team is run by my colleague Manik Deepak Gopinath at the Open University, but also Bashir Udin, CEO of Bangla Housing, and Jeremy Porteous is also a member of our team. And it's legwork. I'm going to say is that the way to say it. We meet as a group every 3 months. We meet as other groups, more common than that. We have to establish trust, and we have to establish people who are community co-researchers working in Bangla, working in Sylheti, working in English. And all of that work has to be transcribed, and we begin to learn far more about the community. So I just wanted to raise that as adding those multicultural issues to this pot of discussion about collaborative housing.
Yeah,
so
really.
I'll leave it there, but if anybody wants to, you'll find me, or you'll find us through the Housing Lynn website, and I'm very interested.
Great, thanks, Sheila. That's great. And just to say that it was a source of disappointment to us as a research team that we couldn't have more diversity in our sample, but it's a function of really how few communities there are out there at the moment. But I think the Housing 21 experiment is definitely something to be followed from that perspective. Thanks, Sheila. So do get in touch with Sheila if you're interested in her research. There was a question in here that I picked up on, which was about succession planning from Wendy Twist, which I think is an important one. And Jim, I'll come to you if that's all right. So she says, I'm researching intergenerational collaborative housing schemes. Jim Hudson mentioned the importance of succession planning, but did you get any indication of benefits and additional types of mutual support that specifically arose within intergenerational schemes? Do you want to take that one, Jim? Are you okay with that? Or any other members of the team who want to come in on that? So the additional benefits of mutual support from within intergenerational schemes.
I saw this question earlier, and I was trying to think of an answer for it. The short answer is no. I think, in that when I'm thinking through the examples of the support of the three co-housing schemes, the one that was the most intergenerational, it tended to be the older, longer established members who stepped up to give that support. And I suppose we're kind of stuck with that because inevitably it's qualitative research, and we had those case studies. I think it probably to some extent reflects the wider gendered and age-directed situations of social care and support, that it's older people giving the care as well as receiving it to a greater degree. And I can't think, I don't know if Mies or others want to come in on this, I can't think of any other examples where there was a different case, younger members of the group who were actively giving support in those situations. Am I right on that?
Well, but I think partly to respond to that, I think even within the senior co-housing group, that it is intergenerational in the sense that it spans, a spectrum of ages from 55 up to 90 plus. So there was, you know, intergenerational support in that sense, and perhaps, you know, the younger members of the community providing support to older members. But as you say, Jim, equally, you know, vice versa. It isn't a one-way street by any means. I wanted to pick up on the point that's also embedded in Wendy's question, Jim, about succession planning.
Interrupt you, Karen. I'm sorry to put you off. It's only just to stay on what we were mentioning before, because you know, Abdul is here with us as a panelist. Yeah. Asked to come in on the previous comment, so we can Abdul in for a moment and then come back. And Kay has also raised her hand.
Okay, thanks.
Abdul and Kay, sorry about that. Thank you, Karen.
Yeah, Abdul. Yeah. Are you there, Abdul?
Can you hear me?
Yes, yes.
Oh,
yeah.
good.
Thanks, Abdul.
You'll have to excuse me. I'm on a train because I've going down to London for the APPG meeting with Lord Best later on this afternoon. So, so pleased to join this event. So the thing that I wanted to just raise is around the fact that we have a very different set of demographics going forward. We have an economy and a society which is aging, but it's also that the demographics are, if you like, changing. Britain has never been more diverse, and it is currently, and it will be the case for decades to come. Now, that imposes some challenges in terms of what has gone on up to now. So as you know, Professor Karen, at the panel discussions, you know, I've been very vocal around the fact that the collaborative housing, co-housing, whatever the model you want to call it, has a huge role to play in terms of alleviating loneliness and addressing the sort of housing care and support needs of older people. Yet there are disparities and differences in terms of how different groups endure later life, let alone as they approach later life. I think my challenge here is that we can't make assumptions from our ivory towers. We need to, as Sheila said, we need to go out and find out, you know, what the mood of communities are. We've done some research in Kirklees with Housing Lynn, which suggests that actually patterns of behavior, patterns of understanding of different option models are more amenable to generation of my age and those before compared to what the profile is at the moment. So I think there is a challenge here that the CHIC and the co-housing movement has to balance between their plurality, their purity, and actually by being pure, they're not being inclusive. I mean, I think Jim knows this very well. We had a co-housing conference that was held in King's Fund, and when we were talking to them, the audience, about the Housing 21 model and approach, we were attacked. We were attacked that we're not preserving the purity of the co-housing model. And I think the reference there was that people don't want change. Well, actually, that's not a position that is sustainable. And my question I pose is that where there is grant funding, whether it's from Homes England or GLA, whoever, you know, there is a duty that accommodation should be inclusive. And where their inclusivity is not happening, then that needs to be challenged. So I think there's a need for research, but as Lucy put it, there are people who need care and support and housing now. So what are we going to do in terms of increasing delivery, as well as we deepen our understanding in terms of how this might go forward in the coming years and decades? Thank you.
Yeah. Thanks, Abdul. Yeah, no, really important perspective. So if I could just say about the purity of co-housing, I think the discussion there, I think I remember what you're referring to. I think it's really about the name, isn't it? I think there are some people who want to kind of hold on to the name of co-housing and don't want that to become diluted. And I think with reference to the Housing 21 project, I think there has been perhaps some disquiet maybe from some people within the co-housing community that might be diluting the brand, as it were. But I think it's just a term, isn't it? I mean, we don't adhere rigidly to any particular term, and I don't think we're particularly purist in our approach to the question. But maybe I could come back with that to Angie. So I think Abdul has raised an important question there, Angie, about any sort of public funding and its need to include diversity and in self-commissioned projects. And I'm wondering, you know, what the approach there might be potentially.
Yeah, I think John was the one coming, but it's all right for me to just say a wee thing, John, then you can come in. Yeah, I actually put on the chat there in response to an earlier question from Sheila that Claude Henriksen, who I don't know if you're aware of, he's been doing quite a lot of work on diversity in community-led housing, and he's worth getting in touch with because he's aware of the fact that there's very little representation across co-housing communities and community-led housing communities as well, and he led one of the first, it was a collective self-build project, but a community-led one with Black men in Leeds, and it was very, very successful. So Sheila, get in touch with him because he's brilliant, and I have been working with Claude and the task force and looking at how we might actually make more of this housing available. And that's where, again, affordability comes in too, because it's about making sure that there's a budget for everyone. That affordability, there was a question on that as well. And obviously there's lots of definitions of what is affordable, but for me, we should have this housing available to anyone with any budget, and that's what we have to work on when it comes to delivery. We need to make sure people can access affordable homes grants that need to, while still delivering this type of community-led project. So I think that's, we are working on it. We are aware of the fact that there's not representation there. So yeah, so we'll do what we can from within the unit and trying to get more land available for it at a better price, and the funding that's required in order to deliver this type of housing. So hopefully that helps.
Great, thanks, Angie. So I think, Kay and John, I think we're wanting to come in at this point. Is that right?
Yeah, thanks, Karen. My comment was about the intergenerational collaborative housing. So I can't remember who had posted something in the Q&A, but I've responded to that now, probably with something that they already know about. But I just wanted to highlight that we've got several home share representatives here today who may have something to say about that, again, notwithstanding what's just been said about the purity of the model. And also I just posted in response to somebody some information about the award-winning Alicante project, which was intergenerational in nature, but again, not wanting to dilute the focus on collaborative housing that we've got here. Thanks.
Thanks, Kay.
Hi,
John,
could I just quickly on this issue of inclusivity? I think there's some very important lessons to be learned from the housing cooperative movement here. Housing co-ops really flourished in the 1970s and 1980s when there was a funding stream. And this comes back to affordable housing grant. And those co-ops were almost invariably for social renting. And some of them were BME co-ops, many of them were BME co-ops. So there are examples of collaborative housing which is inclusive. And it's interesting that Cedar Bank's co-op, although it wasn't diverse in one level, it undoubtedly was there serving a working class community in the Northwest. So there is no issue about inclusivity and collaborative housing. There is no inherent issue. There must not be an inherent issue here, and we need to look at other models. Also, housing can be developed on behalf of co-ops. There are traditions here of cooperative development agencies, and Housing 21 is continuing that the way of working. And that doesn't mean that they're any the less co-ops. Once they take ownership or mutual ownership, mutual control, they are co-ops. They are in ownership and management and or control of their housing. And so that is what collaborative housing is all about. And I agree with you, these debates about purity are counterproductive.
Absolutely. Thank you, John. Jeremy's just pointed out to me here, it's not necessarily about co-housing, but my former colleague Paul Willis has done a fabulous study called Diversity in Care Environments, and there's a link to that there in the chat if people are interested. So he's looking at different kinds of care environments like sheltered housing and extra care and so on, and finding that practices are falling short of serving a diverse community. So if people want to look that up, that's some research that was done at the University of Bristol. I think we've got time for just one more question now before we have to wrap up. And I wondered if I could return to that question of succession planning there, Jim. Are you happy to take that question? So I think there was an interest in some of the comments that you'd made about succession planning and what communities of the future might need to consider in terms of succession planning.
Sure, yes. I haven't got the question in front of me, but yeah, just to say briefly that as I said in the sort of brief summary, some of the groups, and this was co-housing explicitly, felt that they'd ended up with the wrong mix of housing. And in I can never remember the anonymized names. It's at Meadow Ridge co-housing, some of the members were telling us how they'd like to downsize within the scheme, but were unable to do so because there are a small number of flats and a large number of houses, which seemed to fit when the group were mainly kind of in their 50s, early 60s, largely in the planning period. So we'd, as a recommendation, we'd urge groups to kind of think about seriously what the likelihood of the age profile will be in 10 to 20 years time, and what the needs of those members would be. And it's all about, I've used the word downsizing because that was their particular view. It's all about right sizing, really. I wouldn't want to presume for any person in co-housing that they can't live in the house that they want. That's the whole point of co-housing. So we shouldn't assume that it's about necessarily moving from larger homes to smaller homes. And in the case of intergenerational schemes, and I use that term to mean a wide range of ages, from young families up to, well, in our case, in somebody in their early 90s. But the group should think about what its aims are and the age profile that it wants to try and maintain, both in terms of people particularly moving within the group, but also trying to sell homes or to rent homes further down the line if they're trying to get younger members in. And this is something that I think all three groups have struggled with to some extent. That was a bit of a wander around the subject.
No. Great. I don't know if I just want to give a word to any of my colleagues there who've been managing the chat and so on, if they want to come in with any final points, Misa, Amy, or Melissa. No? Okay. There was one question there from Ruth Herpler about methodology and whether we'd gathered any data from a control group. Ruth, we'd be happy to talk to you in more detail about our methodology, but the short answer is no, we didn't, because it was a qualitative study. It was something we did talk about as a research group, but I think given that the point that John has made, that we've got such a kind of diversity of communities already, I think adding a non-collaborative housing group into the mix as well would have just been way too complex to deal with within the confines of this research project. But perhaps we could discuss that offline. So I think it just remains for me to thank very much our panel members for coming along and giving their perspectives on this, and from the challenging questions from the audience. So I think just to briefly summarize, I mean, I think there seems to be sort of broad agreement that these kinds of collaborative grouped living arrangements of various kinds are really important in tackling questions of social isolation, important in terms of keeping people connective and active within their communities, and building resilient communities that can prevent the need, as Kay said, for more intensive forms of support. But there is something about tackling questions of diversity and making sure that that's front and centre of any future research in this area. And that is something that funders of housing need to be mindful of, and as Sheila says, you know, it's a matter of sort of going out of your way to talk to communities about what the kinds of things that they really want. Full autonomy may just not be for everybody. But to come back to John's point, that housing providers, in a sense, need to get with the programme, don't they? They need to recognise people's thirst and willingness to exercise greater control over their living environments and to develop themselves as communities. And that's something that most definitely should be on the radar for the future. So I think, unless there's anything really burning, it's 2 minutes to 12 and we've had no comfort break. So I think I'm going to let people go. But once again, thank you very much to our audience and especially to our panelists. And do download the report and read the report. Thank you.
Thanks, everyone.
Cheers. Thank you.
Thank you.
Cheers, everybody. Fantastic.
Thanks, John.
Session. Fantastic. It will be good to capture a bit of the debate, actually, all those questions that weren't answered.
No, absolutely. It was a little bit scattergun, wasn't it? I was struggling to keep hold of all the different questions that were coming in, trying to make sense
but it was terrific. The level of interest and engagement was fantastic.
Can we save Q&As or Melissa?
Yeah, so I'm clear about that. I sent a question about it. None of us really know.
I'm just going to go through now and copy and paste them all into a document in case it's not saved.
I'm pretty sure it should do, and I've told the participants that if it does, we will send it, because I had a few requests on that to be sent. The chat